How do we apply the findings? How do they relate to the actual on the ground person? Now that we know that these are the causes, these are the norms around diabetes which were not known before, yeah? It shouldn't end up just in a paper publication. So we are saying what can be done, what innovation can come out, yeah, of this information that can inform programming to address the problem. I'm Ramadan Chirunda. I'm part of the research team from Makerere School of Public Health that is conducting a study to identify, to focus on those norms, yeah, social norms that facilitate type 2 risky behaviors. Research has been done, about type 2 diabetes, but little has been, I think, done around the norms, the social norms, because type 2 diabetes is about behavior, it is acquired, it is about how people live, how people eat. It is so much about lifestyle. And lifestyle is actually influenced by social determinants, yeah? But looking at the literature, there hasn't been enough done to really understand how these social constructs influence the behaviors that eventually lead to type 2 diabetes.
And this study, which looks at type 2 diabetes, is very important because right now there is a high incidence in the two districts of Busia and Bujiri. Formerly, Makerere University has been working under the funding of SIDA in Yiganga and Mayuge, where we have the demographic surveillance site. And there's been a major concern because almost 3% to 4% were diagnosed with type 2 diabetes. So every Thursday, first month, they have a diabetic clinic. But currently, it is increasing, and there are many people who are pre-diabetic, and they have the signs, but they are not yet diagnosed, and they don't know that they have type 2 diabetes. And many times it's manifested in the last stages. That's when people realize after visiting the health facility.
Diabetes is for the well of people, but it can also be a disease for the poor, and even like as a population, as public health fraternity, like we need to really understand like what are the entrenchments, what do people think about like these diseases. Some people acquire NCDs just because they're influenced maybe kind in their lifestyle or something. So it's important for us to really understand the socio-cultural perspective.
Recently we realized that there are so many cases that are registered because of diabetes 2 disease. And we believe that even those who are registered are just a few. We believe that there are so many. And another thing is that this project is going to help us also in the assessment and management of this disease. And what I've seen is that what I've learned now is also going to help us to assist people in the prevention of the diabetic type 2, because we have seen that most of the causes are just related with the lifestyle of people.
Diabetes is a silent killer. So I would like to know, are social norms the real cause of type 2 diabetes, their behaviors and characters?
A deep exploration of the factors that are around type 2 diabetes, first of all, identify the key drivers, but also identify the social norms around each of the drivers. Because experience, especially from the SRH, has shown that if you focus on the drivers alone and not the norms around the drivers, yeah, you're actually treating an effect and not the root cause. So that is why we really want to conduct this study in Busia and Bujiri. Those are the two sites which were selected because they are also high volume districts in terms of type 2.
We are going to be testing different qualitative analysis tools
Mango, which is the problem tree, vignettes, 5 Whys. They are new tools in the data market.
The process, the social norms exploration process, is a participatory methodology that we want to adapt. It has 5 phases. We begin by collaborative planning with the district teams, with the communities, the research team, to come up with a clear strategy on exploring. And then phase 2, we identify the patients, type 2 diabetic patients at each of the sites, and then do a social network analysis to understand who influences their behavior, who influences that risky behavior that is responsible for their type 2 diabetes. Once we identify the people or the categories of factors or people who influenced that behavior, then we move to the next stage, the third stage of now exploring, the social norms using the socio-ecological model. So once we finish the exploration, the 4th phase is now the analysis, which is again collaborative. After analysis is adaptation or use of the findings. The interesting bit about this methodology, the social norms exploration approach, is that it allows you to not just explore, but co-design, finally co-design interventions that address the problem whose root causes you now know.
I think this study is so important in a way that it is going to address the core norms. Many other studies have been addressing the problems, the attitudes, but in this study we are looking at the norms, and we find norms being the core cause of the behaviors that lead to type 2 diabetes in very many regions. So it is very important.
But what our project has done is to link the community to the health facility. So that's the reason we are looking at the socio-cultural norms. Many studies usually conduct surveys and we just get numbers. But right now it's people's behaviors we are targeting.
I do think that religious leaders have a role to play in prevention of type 2 diabetes. Why? Because when people are sick, they run to their pastors for help. They believe that their pastors can pray for them and then they get better. They also believe in their word. So we believe that if we involve the pastors or the religious leaders, since these people believe in them, they can help us prevent the disease. So that is why it is very important to empower them, to give them information such that they have the right information they can give to those people when they are sick. Personally, my pastor in Busia has referred to me 5 patients who are type 2 diabetes. So I really believe that if she was empowered with information, she can give them the right information on top of referral to the right places for management.
I think actually after this research, we believe that it will help to inform all the stakeholders that can actually play a role in seeing how best to work around the norms that affect these risky behaviors.
We are going to interview them. We are going to know what could have caused the disease, and then we are going to base on that, and then we start teaching the community about the prevention of diabetes too, and we shall also try to integrate it in other programs in the community so that as we move to carry out our outreaches, be it immunization, we shall also be talking about the diabetic type 2 causes.
We will be identifying the patients, we will be collecting data, we will be collaboratively analyzing it. And the beauty is that the district health teams as well are going to be part of the process. So we have trained people from the districts because we want it to be applied, not just research. It is research to implementation. So once we are done with that, we will have a dissemination, we will have an insights workshop now to co-design the change package, and see at which points can we integrate these findings into the health communication, strategies of the districts, if they are existing. If they are not, how do we ensure that there is normative, responses, normative interventions that respond to type 2 diabetes and other NCDs, because largely NCDs are not given attention, but we definitely think that this is going to be a game changer, a new way of looking at type 2 diabetes.
The project is funded by Makerere University Research and Innovation Fund and Government of Uganda. So its aim is to come up with a social innovation, and our social innovation peer groups which have been set up, and also looking at people's behaviors by using problem tree analysis to understand the underlying causes and how type 2 diabetes is manifested in the society.
Considerations for adjusting the programs